Hello, this is Dr. Brooke Patterson, and this lecture discusses the components of a health history. While I want you to understand each component, I think the format will make much more sense when you do your health history assignment later in the semester. You will need to refer back to this lecture prior to completing that assignment. For now, I just want you to have a basic understanding of the terminology, components, and flow, as well as different strategies for obtaining information, specifically sensitive topics. It is important to understand the difference between a comprehensive or focused assessment. Comprehensive exams apply to new patients and all settings. It provides fundamental knowledge, builds the nurse-patient relationship, and most importantly provides baseline health information, creating a platform for health promotion and prevention. A focused assessment, however, is used for established patients in primary care or for patients who are presenting to an emergency room or urgent care with a specific problem. Its purpose is to focus on specific concerns and narrow down specific body systems. I really like this slide because it provides a simple outline to the comprehensive health history. We will dive into each of these topics and expand upon the rationale of each one. We begin with initial information and identifying data. The source of the history is who furnishes the information, who is usually the person seeking care, although the source may be a relative or friend, especially in cases where the patient may not be able to speak, have a reduced level of consciousness, or altered mental status. It is very important to judge the reliability of the informant. Reliability leads to the consistency of information. An informant may not be reliable, for instance, if they are intoxicated or confused and unable to provide accurate information. It is also important to note any special circumstances, such as the use of an interpreter. The chief complaint is the reason the patient is seeking care. It should be a brief statement in the person's own words describing the reason for the visit. For example, a chief complaint could look like a headache lasting for 7 days, or worsening cough and shortness of breath. The history of present illness includes specific characteristics of the problem. This is where OLD-CARD fits in. I've included a few of these practice questions throughout your lectures because they are examples of what your quiz and exam questions could potentially look like. This first question asks, when a nurse concentrates on gathering information about the patient's current problem, he or she is completing A, comprehensive health assessment, B, focus assessment, C, follow-up history, or D, emergency history. The correct answer is B, a focused assessment. This is when a nurse concentrates on just gathering information about the patient's problem. The comprehensive health assessment is used with new patients. The follow-up history is appropriate when the patient is returning to have a problem or treatment plan evaluated. The emergency history is conducted in an emergency situation focused on the patient's emergent problem. Not to confuse you, but a focused assessment may also be a part of the emergency history. The next few slides list the other components of the comprehensive health history. You will want to note the patient's allergies. However, you don't want to just list the allergy. It is important to include a specific reaction to each allergen. Oftentimes, allergies are confused with intolerances. For a conclusive medication list, all medications over the counter, prescriptions, vitamins, herbs, and supplements, etc. need to be listed. It is also important to note the dose, route, and frequency of each medication. These are the types of details that you will fill out on your health history form later in the semester. For childhood illnesses and adult illnesses, surgeries, or accidents, it is important to note the approximate date, age, or year of each incident and if there are any complications. For immunizations and screenings, it is also important to note the approximate date or time. If the date or time is not known, simply write unknown. In all health history components, it is really important not to leave anything blank. Simply writing unknown or none significantly helps rule in or rule out substantial information. You will want to refrain from using NA in most of your documentation. We will talk about when it is appropriate and inappropriate to use NA when we discuss your documentation note assignments. For alcohol, substance abuse, or tobacco, be sure to quantify the amount and also be specific on the type. For example, if the patient drinks alcohol, note if they drink wine, liquor or beer, etc., and the frequency. A glass of wine may have a different meaning from one person to the next. I wanted to include this picture of a genogram. We actually have an upcoming risk assessment assignment where you will make a very simple genogram. This is helpful to visualize and understand a patient's family medical history and assist with planning future preventative and health promotion strategies. For the family history, you will likely see a list of disease processes. You will most likely be able to check yes or no, and if yes, the relationship to the patient, for example, mother or father. If alive, how old they are, and if deceased, the age they were when they died. When you're getting to the end of your comprehensive health history, you will complete what we call a review of systems. A review of systems is exactly what it says it is and addresses each body system from head to toe. If there are no problems with the system, you will simply put none. The purpose of the review of systems is to make sure that a patient has not overlooked certain signs and symptoms and may uncover problems the patient has missed or not seen as important. This slide just lists an example of the types of questions that would be a part of a review of systems. When we gather all this information, at the end we can start establishing specific health patterns, interpretations, and truly see the patient from a holistic standpoint. Question 2 states, a good tool to use to assess alcohol use is the A, CAGE questionnaire, B, Assess D questionnaire, C, Gauge questionnaire, or D, Audit C questionnaire. The answer is D, Audit C questionnaire. The most widely used screening questions are the Audit C questions about quantity and frequency of alcohol use. It is important to note that some of these questions will be sensitive in nature. Being non-judgmental and explaining why you need to know certain information are ways to help the patient feel more comfortable. If you already anticipate discussing sensitive information, in advance, try to prepare questions and research approach strategies. Consciously acknowledging your discomfort and interview prep assists with patient comfort, thereby fostering trust and caring behaviors. For information regarding a patient's sexual history, this is where you need to think about disclosing why you need the information. This slide lists specific examples and rationales you could provide to your patients. Another sensitive topic is a mental health history. It is important to be aware of cultural variances. Be sensitive and intuitive to reports of mood changes or depression symptoms. It is important to ask about medication use, including the use of psychotropic medications or other remedies. If the patient is reporting depression, it is imperative that you screen for thoughts of suicide or harming others. It is important to treat all patients equal and not to make assumptions. Sometimes the most cheerful people can put on the best mask, but deep down are thinking about harming themselves. Don't let this opportunity pass you by because you simply thought they were okay, or they didn't seem like the type of person who would do that. Continue to be vigilant, kind, and caring. Remember, the more your patients trust you, the more likely they will open up, thereby deepening the impact you may have on their lives and families. The following indicators should be considered when family violence is suspected. When abuse is suspected, it may be important to privately assess the patient. Be sure to be alert to both verbal and nonverbal communication. Physical abuse should be considered in the following situations: unexplained inconsistent injuries, delayed treatments, repeated injuries, history of alcohol or drug abuse. Also be vigilant to partners who may try to dominate the conversation and potentially refuse to leave or portray anxious behaviors. These sensitive topics and scenarios can be intimidating and even scary. Just remember that you are not alone. Utilize your nurse colleagues, nurse managers, and/or charge nurses if you need support in these special situations or would just like someone else to be in the room with you.